Welcome back to Get Connected. I'm your host, Conn Jackson, and our health beat is upon us, and this is where we keep the pulse on your health. And the term we're talking about today is fibromyalgia, which of course I cannot say. And luckily we have two guests that can tell us more about it and tell us what we can do. We've got Dr. Edelberg and Elizabeth. Welcome to the show.
Great to be here.
Thanks for having us.
Well, Elizabeth, it's always great having you back. And Doctor, I'd just like to know, first of all, how do you say fibromyalgia?
Fibromyalgia, which really just means muscle pain in Greek, is a condition where the majority of patients, 90% of them, are women. And the numbers of patients with fibromyalgia is huge. Estimates up to 8% of women suffer the pain and exhaustion of fibromyalgia. That's the same number of women, 12 to 15 million, that have diabetes. So we're talking about a huge, huge epidemic going on of women in chronic pain.
You know, Doctor, I didn't realize how serious it was. What are some of the early symptoms?
It begins really rather slowly with pain and stiffness in the neck and upper back, headaches, jaw grinding, and then slowly travels over the entire body so you feel encased in a painful suit of armor. It's really not a disease like diabetes or rheumatoid arthritis. It's more an unchecked reaction to stress, the fight and flight button with the button held down and in place with a piece of duct tape, and muscles chronically tight all the time. That's fibromyalgia. Then she should discuss it with her doctor. If her doctor says there's no such thing as fibromyalgia, hand them some stuff printed off the internet. If he still doesn't bite, then you've just got to find another healthcare practitioner.
Elizabeth, I'm just curious, what would you say to women that might think they have the onset of fibromyalgia?
We want women to know that fibromyalgia is a real medical condition. We are here to provide information that there are medical treatments available, along with a combination of alternative treatments. She can successfully manage her fibromyalgia, and to really empower women to begin that important conversation with their healthcare provider. The signs and symptoms need to be discussed. As Dr. Edelberg shared, she needs to have a healthcare provider that will listen to her and that can properly diagnose her, and then she can manage and live successfully with fibromyalgia.
Well, from the sound of it, it sounds like this condition is quite difficult to diagnose.
In a recent survey that we did, we found that of over 500 women that are currently living with fibromyalgia, it took 50% of these women a year or more to get diagnosed with fibromyalgia, and a quarter of them, it took over 5 years for them to be diagnosed with fibromyalgia. So we know early treatment options are much better. So if women are diagnosed earlier and begin treatment, they can live, pain-free.
Well, I must say it's great to have you two as champions behind this cause, helping out women and men that suffer from this condition. Thanks for joining us.
Thank you.
Thank you.
Always great having Elizabeth back with us, and it was nice to have Dr. Edelberg as well. You can catch other Health Beat segments right here on Get Connected at our website at conntv.com. We've got a big surprise as we unveil our big trip to Prague, and we want you there.